1. A patient presents with chest pain and shortness of breath. What is the nurse's first action? A. Administer pain medication. B. Obtain an ECG. C. Call the healthcare provider. D. Start IV fluids. Answer. B. Obtain an ECG. Explanation. Chest pain and sob may indicate a myocardial infarction. ECG should be done within 10 minutes of arrival. 2. Which of the following is the priority intervention in a patient with anaphylactic shock? A. Administer IV fluids. B. Place the patient in Trendelenburg position. C. Apply oxygen. D. Administer epinephrine. Answer. D. Administer epinephrine. Explanation. Epinephrine is the first-line drug to reverse the symptoms of anaphylaxis. 3. A trauma patient with suspected spinal injury should be A. Log rolled during movement. B. Placed in high Fowler's position. C. Encouraged to walk. D. Given pain medications immediately. Answer. A. Log rolled during movement. Explanation. Log rolling prevents further spinal cord injury during repositioning. 4. Which lab value is most important to monitor in a patient receiving heparin for DVT? A. Part B INR CAPTTD platelets. Answer. CAPTT. Explanation. Heparin therapy is monitored using a PTT to adjust dosage. 5. The nurse finds a patient unresponsive with no pulse. What is the next best action? A. Start CPR. B. Call the family. C. Check blood pressure. D. Administer oxygen. Answer. A. Start CPR. Explanation. Immediate CPR improves survival in cardiac arrest. 6. A patient with suspected stroke arrives at the ED. What is the priority assessment? A. Blood pressure. B. Blood glucose. C. Cort scan of the head. D. Oxygen saturation. Answer. Circa Cort scan of the head. Explanation. CT determines if the stroke is ischemic or hemorrhagic, guiding treatment. 7. A nurse is triaging multiple patients. Who should be seen first? A 65-year-old with chest pain. B. 45-year-old with a broken arm. Circa 30-year-old with a twisted ankle. D. 25-year-old with fever and sore throat. Answer. A 65-year-old with chest pain. Explanation. Chest pain can indicate a life-threatening condition and is a high priority. 8. Which symptom suggests A. Tension pneumothorax? A. Bradycardia. B. Midline trachea. C. Diminished breath sounds on one side. D. High-pitched bowel sounds. Answer. C. Diminished breath sounds on one side. Explanation. Air trapped in the pleural space reduces lung expansion on the affected side. 9. The priority in a patient with major burns is A. Pain control. B. Infection prevention. C. Airway management. D. Dressing changes. Answer. C. Airway management. Explanation. Inhalation injury and airway compromise can occur rapidly in burn patients. 10. A patient overdosed on opioids. What is the antidote? A. Atropine. B. Naloxone. C. Flumazenil. D. Protamine sulfate. Answer. B. Naloxone. Explanation. Naloxone reverses respiratory depression caused by opioids. 11. A patient is brought in after a motor vehicle accident. The first priority in trauma assessment is A. Assess airway. B. Control bleeding. C. Check for fractures. D. Start IV access. Answer. A. Assess airway. Explanation. According to the ABCs of trauma, airway is assessed and secured first. 12. A patient with diabetic ketoacidosis, DA, is admitted. What is the first priority? A. Administer insulin. B. Monitor potassium levels. C. Check temperature. D. Administer IV fluids. Answer. D. Administer IV fluids. Explanation. Fluid replacement is the initial treatment in DKA to correct dehydration. 13. Which symptom is most concerning in a patient with head trauma? A. Headache. B. Unequal pupils. C. Nausea. D. Bruising. Answer. B. Unequal pupils. Explanation. Unequal pupils may indicate increased intracranial pressure or brain herniation. 14. A child is choking and cannot speak. The nurse should immediately A. Perform CPR. B. Administer back blows. C. Do abdominal thrusts. D. Give oxygen. Answer. C. Do abdominal thrusts. Explanation. Abdominal thrusts, Heimlich maneuver, are used for conscious choking victims over 1 year old. 15. What is the most appropriate intervention for a patient with hypovolemic shock? A. Administer IV fluids rapidly. B. Give insulin. C. Monitor for fever. D. Keep the patient in high Fowler's position. Answer. A. Administer IV fluids rapidly. Explanation. Fluid resuscitation is essential to restore circulating volume in hypovolemic shock. 16. What is a common early sign of sepsis? A. Hypertension. B. Hypoglycemia. C. Altered mental status. D. Bradycardia. Answer. C. Altered mental status. Explanation. Confusion or altered lock is an early indicator of sepsis, especially in older adults. 17. A nurse observes a patient having a seizure. The priority action is to A. Restrain the patient. B. Insert a tongue blade. C. Check blood pressure. D. Move objects away from the patient. Answer. D. Move objects away from the patient. Explanation. Ensuring safety by removing harmful objects is the immediate priority. 18. A patient in the ED is hyperventilating and dizzy. What is the likely cause? A. Respiratory acidosis. B. Metabolic acidosis. C. Respiratory alkalosis. D. Metabolic alkalosis. Answer. C. Respiratory alkalosis. Explanation. Hyperventilation causes CO loss, leading to respiratory alkalosis. 19. Which intervention is appropriate for a patient with a suspected cervical spine injury? A. Tilt the head back to open the airway. B. Apply a cervical collar. C. Have the patient sit upright. D. Turn the head to the side. Answer. B. Apply a cervical collar. Explanation. A cervical collar immobilizes the spine and prevents further injury. 20. What is the initial treatment for ventricular fibrillation? A. Oxygen therapy. B. CPR and defibrillation. C. Epinephrine injection. D. Cardiac catheterization. Answer. B. CPR and defibrillation. Explanation. VFib is a life-threatening arrhythmia that requires immediate defibrillation.